Welcome to RHS Inside News for August 10th, 2011. Today at Rockford Memorial Hospital, a news conference was held that announced that Rockford Health System had recently become the first hospital in the region to offer a new state-of-the-art procedure for breast cancer treatment. Surgeon Dr. Fred Church and Dr. Karen Smorowski, a radiation oncologist, described this new procedure.
The procedure I'm talking about is Intraoperative Radiation Therapy, or better known as IORT. Traditionally, standard treatment for ladies with breast cancer who require radiation therapy undergo 33 treatments. So it's 33 trips back and forth to the hospital. It's once a day, 5 days a week for about 6 weeks. Intraoperative radiation therapy is a means by which we can treat patients with breast cancer in a single dose while they're asleep in the operating room under general anesthesia. After the cancer is removed and the lymph nodes are checked, there is a balloon catheter that's placed in the space where the cancer was removed. There's a few sutures placed in there to snug the tissue up around the balloon. The catheter comes out the skin and is attached to the equipment that Dr. Smorowski is going to tell you about.
We actually have our machine here. This is called the ZOFT, high dose rate brachytherapy machine. And once the catheter that Dr. Church showed is inserted into the patient, this is actually a very, very tiny X-ray tube that's inserted into the catheter. It's slowly withdrawn out of the balloon and delivers a conformal dose of radiation therapy to just the tissue surrounding the biopsy cavity. Treatment takes about 20 minutes. The patient wakes up and her radiation therapy has been completed.
The first patient to receive this new state-of-the-art procedure, Deborah Grimes, was at the press conference and shared her thoughts on being the first person in the region to benefit from this technology.
It's amazing. It's an awesome breakthrough. Not only that, but like they said, the inconvenience of having to go all the time. I mean, if that's the way you have to go, that's the way you have to go, of course. But to have this option for some people is really amazing, because it does cut down a lot of the stress and possibly skin issues from radiation, because you only have the one-time treatment probably. So there's a lot of things that it's really beneficial.
IORT isn't for everyone, and some criteria must be met first in order to have this procedure. Dr. Church explains.
There are some criteria that have to be met before we can use it. The patient has to be at least 45 years of age. The cancer has to be removed completely, so the margins around the tissue removed have to be clear. The lymph nodes must be negative for metastatic disease, in other words, no cancer in the lymph nodes under the arm. And there has to be a distance of at least 7 millimeters, which is only about that much, between the skin and the balloon catheter, so the skin does not get burned or radiated and have any effects from the radiation during or after the procedure.
This has been RHS Inside News for Wednesday, August 10th, 2011. If you would like more information about the IORT procedure or on our Women's Center, please call 815-971-2000.